Ghana's healthcare delivery is at a tipping point. The outflow of nurses from the country is leading to understaffing at many hospitals. Gifty Ayi heads the nursing department at a hospital in the capital Accra and says the situation is dire.
It's the specialized nurses who are being taken. The ICU nurses, the intensive care nurses, the perioperative, those who deal with surgery, who scrub with the doctors, and the emergency nurses. They are going. And they are very critical. Because of that, in my main ICU, I have 5 beds. Naturally, 1 nurse to 1 patient. So I have to have 5 ICU nurses, morning, afternoon, and night, which will be 15 in a day. Now, I have only 5 of them left.
Ghana's Registered Nurses and Midwives Association says more than 4,000 nurses and midwives have left the country to seek better opportunities abroad in the past year. Authorities at this hospital say the increase in the number of nurses migrating from Ghana to the UK and other European countries is putting a strain on the country's health sector. Each nurse looking after at least 10 patients have to put in more hours to keep the facilities running, and it doesn't come with extra pay. If the trend continues, there are fears that Ghana's health sector could face a crisis.
If the nurses are exhausted, they make mistakes. They are burnt out. So when it happens that way, service delivery is diminished. You can't take the cases that you want. And when the cases are there, the care you give to is not very adequate.
The migration of healthcare workers is not peculiar to Ghana. In Nigeria, reports show that more than 75,000 nurses left the country for jobs abroad in the last 5 years. Officials in Ghana say between January and July this year, more than 10,000 nurses have applied for clearance to leave the country for jobs abroad.
People want to move because they want to better their lives. They want to move because there are certain push factors here and there are certain pull factors out there. For the high income earning countries, of course, we all know the salaries are better, the conditions of service are better, and therefore it's more attractive to them.
Ghana and many other African countries are bearing the brunt of this brain drain as they spend millions of dollars to train healthcare professionals, only to lose them to overseas markets. Ghana's government has appealed to health workers to stay in the country while it tries to improve their conditions of service.
Health is an essential service, so it should be treated differently from other non-essential services. And then maybe people also having the core like they do for the other essential services. People know that when I retire, maybe I retire on my salary and all this. These are things that we are sitting down to talk about and then come out of a very comprehensive conclusion.
But it may take a while for this to be realized. Many nurses and other health workers in Ghana feel they have no other option but to seek better opportunities abroad. Nabil Ahmed, Rufai, Accra, Ghana.